3 ventilator modes, 1 critically ill patient. The mode you choose could mean the difference between lung protection and lung injury. In the next few minutes, you're going to understand exactly when to use assist control, PRVC and ASV. Not just what they are, but why they matter clinically. Whether you're a new RT, a seasoned nurse, or a provider managing vents in your LTAC or ICU, this one is for you. And stay to the end. I'm going to give you a 1-sentence clinical consultant shortcut that I use with every ventilator evaluation. Let's start with assist control, a C. This is your foundation mode. It guarantees ventilation, full stop. Every breath is either triggered by the patient or delivered by the vent on a set rate. Either way, the machine delivers a full breath. That's powerful when you have a fully sedated post-op patient or someone crashing in acute respiratory failure. Here's the clinical example. A patient, fresh intubation for severe pneumonia. Richmond agitation score, -3. Propofol running. This patient cannot reliably drive their own breathing. You need AC. You need guaranteed ventilation. The catch? You have to watch for breath stacking, auto PEEP, and high plateau pressures. AC doesn't auto-adjust. It delivers what you set every single time. Now let's talk PRVC, pressure-regulated volume control. This mode is what I call a smart pressure mode. It targets your set tidal volume, but it uses the lowest driving pressure possible to get there. Every few breaths, it reassesses compliance and adjusts pressure up or down to hit your target. That makes it a strong lung protective strategy, especially in your LTAC patients where compliance fluctuates day to day. Picture this, a long-term vent patient with a healing ARDS. Yesterday they were stiff, today they're a little more compliant. With AC, you're delivering the same pressure regardless. With PRVC, the vent backs off when the lungs open up, reducing barotrauma risk without you having to manually titrate every shift. PRVC is one of the workhorses of chronic vent management. Learn it, trust it. And then there's ASV, Adaptive Support Ventilation. This one is different in a fundamental way. It's a closed-loop mode. You set a target minute ventilation as a percentage, and the vent figures out the best combination of tidal volume and respiratory rate to hit it. That means it's constantly adapting. As your patient wakes up and starts breathing more on their own, ASV steps back. As they fatigue or become apneic, it steps in. It's designed to support synchrony and facilitate gradual weaning. This is phenomenal for your neuromuscular or post-surgical patient who's waking up slowly. But one important caveat, use caution in severe ARDS or a patient with high respiratory drive. ASV is optimizing for efficiency, not for ultra-low tidal volumes. In those cases, you want more manual control. Let me tell you about a call I got at 2 in the morning at an LTAC facility. Nurse calls. Patient is fighting the vent. Pressures are all over the place. RN wants to know if we need to bag them. I go in. Patient is in AC. Compliance had been improving all week, and nobody had reassessed the mode. The vent was delivering those big guaranteed breaths into lungs that no longer needed that level of support. Patient was trying to breathe around it. We transitioned to PRVC, dialed in the settings, and within 20 minutes, patient was synchronous, pressures dropped. The RN called back and said it looked like a different patient. That's not a complicated clinical intervention. That is mode selection done right. So here's that consultant shortcut I promised you. When I'm evaluating a vent patient, I run through this line in my head. Mode number 1, a C guarantees ventilation. PRVC protects volume with safer pressures. ASV adapts to the patient. Say that 3 times and you'll never confuse these modes again in clinical practice. If this helped you, hit subscribe. I put out clinical education like this every week, built specifically for RTs, nurses, and providers who want to understand the why behind the vent. And if you want the quick reference card for these 3 modes, the kind you can actually pull out bedside, the link is in the description.